Hello, welcome to our channel Pregnancy Solutions with Gerard Massa. Today we are going to talk about infertility. We need to first of all define what infertility is. This is a condition whereby a couple tries to have a child, a woman tries to get pregnant, of course together with her partner, male partner, but for a period of 1 year, despite having sex regularly, the pregnancy does not happen. Specifically, a couple has tried for one good year and they've not been able to get pregnant. We call that infertility. Now, we need to first of all identify what could be causing this. We need to first of all go to the two types of infertility. There is what we call the primary infertility. Primary infertility is when a couple tries, when a woman tries to get pregnant, but things just don't work out. She has never had a child before, but she tries to get pregnant and things just don't work out. Now, that is what we call primary infertility, the condition whereby a woman who has never had a child before tries to get pregnant, but things just don't work out. And then with secondary infertility, specifically she has ever had a child, the woman has ever had a child, but she tries again to have the second born or to add on the second child, but things just don't work out. So in primary infertility, a woman has actually never had a baby, she tries to get pregnant, things don't work out. And then in secondary infertility, a woman who has ever had a child fails to get pregnant with a second child. Having talked about the two types of infertility and having looked at infertility itself, looking at the definition, then we need to go to what are the checkups? How can really infertility be diagnosed? How can it be investigated, and how can you find out that yes, there's actually infertility happening? Now, without further ado, we shall go to the tests that can be done to really identify that yes, this is infertility. These tests are going to be divided into three groups, and I will talk about first of all the hormonal tests, and then we shall go to the radiological tests, and then of course also there are tests which can be done more specifically by assessing a woman, by talking to her and then finding out what could be causing this. It could actually even be due to kind of emotions. So without further ado, we shall go to the structured radiological tests. The tests we are looking at right now include the investigations of the structure or the anatomy of the uterus. When we talk about the anatomy of the uterus, specifically, we are looking at how the uterus is. Now, there are two types of tests that can be done when we are looking at the anatomy or the makeup of the uterus. The first test is the ultrasound scan. An ultrasound scan can be done on a woman, and then of course a whole picture, a complete picture of her reproductive system, including the ovaries, the fallopian tubes, the uterus, and the cervical canal can all be assessed. If at all the ultrasound readings show that the uterus is filled with masses, polyps, or cysts, these are actually identified, and of course the gynecologist or your doctor will begin from there. Simply put, they will have to manage what is in the uterus, and then we hope and pray that the infertility can be dealt with, because we know that masses or cysts in the uterus, much as they may not really be the number one cause of infertility, but they have an effect in actually preventing pregnancy from happening. So we advise all clients out there, you should actually go and do these tests. Go see your doctor who will order for these tests, and specifically the first test we are looking at is the ultrasound scan. have yourself an ultrasound scan done, and whatever comes out, please just really agree with what your doctor will tell you, and we really hope and pray that things will work out. So the first test is ultrasound scan. The second check under radiological checkups is the HSG. It is what we call the HSG. When we talk about the HSG, specifically we are talking about the hysterosalpingogram. Hysterosalpingogram is actually a test whereby a color or a dye is injected into the cervical canal or the cervix of the woman, and then this color or dye goes into the uterus, and then it filters or it infiltrates into the fallopian tubes. Now, as it is moving through the fallopian tubes, if at all maybe there's blockage somewhere, it gets blockage somewhere, then there are high chances that this color will not move along the fallopian tube. Normally where there's blockage, there's no movement of this specific dye. So the HSG is one of the best tests we recommend all women to have. Make sure that you have your HSG done. First of all, see your doctor, see your gynecologist who will order for the HSG. And this is done by a specialist radiologist. Make sure that you take care before you do your HSG. There's some pre-medication, pre-advice that is actually given, and according to what they will tell you, the instructions before the procedure, please just follow what they will be telling you. Now, as a word of note, basically we are looking, I will tell you that before you go for your HSG, before you have it done, just make sure that you actually check yourself for UTIs, check yourself for infections. The main reason I'm talking about checking yourself for UTIs or infections is this. If you have, let us say, if you have chlamydia, for example, in this particular case, and you go ahead and do the HSG, then there are high chances that, remember we said that the color or the dye is injected and then it travels to the tubes. So if at all, in this particular case, you've been having your, you've been having chlamydia, you didn't know that you have the chlamydia, then as this color is infiltrating, as this color is traveling through the tubes, then there are high chances that it's going to move along with the chlamydia. It's going to move along with the infection, whichever infection you're having, up to the tubes. So be careful when you're going for your HSG. Have yourself checked for any infections before you have the procedure done, because we don't want to worsen things with more infections moving to the tubes. And normally it is a bit, you'll feel pain, but we always say that the doctors who have done the procedure will give you the post-procedure medication. They will advise you on what you need to take, and of course to make sure that you keep the pain down and to make sure that the pain goes down. So we are looking, remember, we are looking at the tests that can be done in infertility, to really find out what could be causing the infertility. Give this video a like. Remember to hit the bell for notifications. Ask me all your comments down below in the comments, and I will answer all your questions personally. Tell more friends about this channel. We talk about pregnancy, talk about fertility, infertility, the best pregnancy YouTube channel. And please, thanks a lot for sparing some time to come and listen to our lessons. We shall move to our next check for next investigation for infertility, and specifically here we are going to look at the hormonal screen test or the fertility screen test. Now, when we talk about the fertility screen test, specifically we are looking at what tests can be done to really assess that maybe this could be a hormonal problem. You just never know. The radiological tests, your HSG may be normal. You could actually even do the ultrasound scan and it is normal, but we need to find out what could be happening with the hormones. Now, there are several hormones that are really present, but in this particular case, we are looking at specifically the key hormones here. We need to look at your follicle stimulating hormone, and also we need to look at your luteinizing hormone, and then of course also we need to look at progesterone to see really how best, what are the levels for these hormones. If at all, let's say your ovarian reserves are really very low, then there are high chances that your follicle stimulating hormone is going to be actually high. So very high follicle stimulating hormone, or if at all these hormones are not balancing, then there are high chances that specifically the pregnancy may not be able to really proceed. So make sure that you actually have these tests done, specifically the hormonal or the fertility hormonal screen. This is very important. It's very key. Just make sure that you have these done, and I have a strong feeling once we discover that it was a hormonal problem, then there are high chances that you're going to get medication to stabilize these hormones, and then of course once they are stabilized, we hope and pray, we believe that by God's grace things will work out and you will be pregnant. Believe. Thanks a lot. We've looked at the hormones, we've looked at the ultrasound scan, we've looked at the HSG, that is the Hysterosalpingogram. Now the next test that is going to be done specifically is to really look at the male pattern, because many times it's always they will always say that probably it could be the woman with the problem, but with experience, many of the clients who come in, you realize that you may find that the female or the woman is very okay. There are no problems with the female. You've done the checkups, the HSG, everything is okay. You've done the hormonal screen test, everything is okay. The hormones are balancing. Then we always advise that you talk to your male partner so that they also go to hospital, and then of course they have these tests done. And more specifically, we need to do an assessment of STIs or sexually transmitted infections, because they could also impair sperm production in a male partner. But simply put, the most important, the key test that is done in men is the semen analysis test. The semen analysis test is a test whereby the semen of your male partner is taken off. The doctors will tell you, the doctors will direct him how to collect the sample, and then of course analysis can be done for sperm count. They will look at the amount of sperms in that particular sample. They will look for the motility or the speed of the sperms, and then of course they will also look at really whether they are viable or they are not viable. So we advise that you talk to your male partner so that at least an analysis can be done of their semen. And then of course this is very important to make sure that everything is working out well. So once again, we are going to summarize our lecture today, our lesson for today. And remember, we've been looking at infertility, and we've said this is when really a couple tries to get pregnant, and actually for a period of 1 year after having regular sex, things just don't work out. And then of course we've also looked at the two types of infertility, and we've said that the first type is what we call the primary infertility, whereby a woman who has never had a child tries to get pregnant, but things just don't work out. And then we've also looked at the secondary infertility, whereby a woman has had a baby before, but she actually finds it difficult. It becomes difficult to really add on the second child. So there are two types of infertility. There's primary infertility and there's secondary infertility. And then of course we've looked at the investigations that can be done, and the investigations we are looking at here, they are divided into many. Feel free to add on any maybe I've not talked about, but feel free to add on any you could actually be knowing. Learning is really so good, and it's really good that we learn here so that at the end of it all things work out. We've looked at the first test, and the first test is the HSG test, also known as the Hysterosalpingogram. It is key for all women who have tried to get pregnant and things are just not working out. And then of course we have the ultrasound scan. This is very important because it will give the whole picture of the system of the female. We shall look at the fallopian tubes, we shall look at the ovaries, whether they are okay, whether they are having any cysts or any masses, ovarian masses. And then of course the most important thing is we shall look at the endometrium or the inside of the uterus to assess whether there's fluid or there are any masses in there. And then of course it will give us a whole picture of the cervical canal, whether it is swollen or it's not swollen. And of course, since they are doing the HSG, just as a reminder, just make sure that they assess or they screen your cervix for cancer of the cervix. It's called the cancer screening test. Have it done because as a requirement cancer is on the rise. So make sure that the cervix is screened, and then of course once screening has been done, early detection is very important, just in case things will come out when they are not good. But as a requirement, we advise that please, as they are doing the HSG, let them first screen you for cancer of the cervix. Yeah, thanks a lot once again for joining me on this lesson. Remember to give this video a like, subscribe, hit the bell for notifications, and ask me all your questions. I will answer all your questions. Pregnancy Solutions with Gerard Massa, the pregnancy site, the pregnancy YouTube channel. Have yourself a fantastic day, and God bless you. Remember, believe, things can work out. You can get pregnant. Pass on this video, share it on your social media, and bye-bye.